So these are really good points. And so one of the problems we've had with breast implant illness is that we just know nothing about it. So when women started coming forward and saying that they weren't doing well after having their breast implants put in, they just didn't get the care and consideration that doctors should have given them. And so there's just been a lot of haywire theories that have gone nuts in the breast implant illness online community. So there's been a lot of theories about there being heavy metals in implants that are leaching into the body and are like concentrated inside of the capsule. There's not heavy metals in implants. So there's trace heavy metals left behind from the processing and how the implants are made, but there's not like ingredients, like you'll see a lot of that on some of these breast implant illness sites. So they thought that the capsule needed to be removed in order to remove the buildup of these things. I guess the theory was the capsule is some kind of, special thing that can keep that in around the implant, and that, you got to get rid of it. So that just doesn't make any sense, as you have already alluded to, because if you're leaching heavy metals, if that's really what was happening, you'd expect it just to be all over the body. There's nothing magical about a capsule that would, or scar tissue sac around your implant that would hold it in. And so there's now actually been studies done. The same group that did the capsule study here in the United States has additional studies looking at different things with breast implant illness patients, and they found that there's no increase in heavy metals in their capsules versus even women who have never had breast implants when they just sampled their breast tissue. So that's kind of turned into a no-go. The problem is for so long they believe that so deeply that it's really hard to alter that belief system. And biofilms are a similar thing. So they just put out, that same group, the next installment of this series of papers looking at biofilms, and it's looking like biofilm is not going to pan out as being a cause of BII either. So biofilms are very, very common on breast implants. You have a natural microbiome of your breast. Your ductal system is open through your nipple. You also potentially can get skin flora on your implant. And so the theory is that it's able to live there, create a biofilm, and create chaos in your body because the implant is there. And then a lot of people thought that if you leave the capsule in, it can somehow live on the capsule, which is generally not the case for a normal capsule. And we don't even really have good evidence that biofilms cause breast implant illness-like symptoms either. And if you read the most recent paper, it casts some doubt on that as well. So the papers that have come out have been very frustrating, I think, for the breast implant illness community, because it has countered a lot of the very firmly held beliefs about why breast implant illness happens. We like it because we're now ruling things out and we can keep moving forward trying to figure out what this is. There's no use spinning our wheels obsessing about things that just aren't true, like the heavy metals and the biofilm. So onward and upward we go to try to take better care of these patients.